Hey everybody, today we are going to be talking about dermatomes. All right, so what is a dermatome? Okay, let us focus on our terminology. Whenever we can't figure something out, let's turn to terminology to help us break it down. So, the prefix derm means skin. Dermatomes. What does tome mean in anatomy? That is a suffix that means cutting, cutting instrument, section, or segment. So, dermatome. Today we're talking about dermatomes or skin segments. Dermatomes are skin segments, all right? Segments of your skin that rely on nerves that connect to your spinal cord. That means that dermatomes cover your entire body except for your face. The nerves of your face are an exception because they don't have a connection that travels through your spinal cord. We'll talk about that in just a minute. But the spinal nerve for each dermatome is really important. It carries all of the nerve signals traveling between the dermatome and your brain. The nerves in the dermatomes also send signals to the brain, which is how you have your sense of touch. The sensations of hot and cold, remember, are thermoception or thermoreception, and your ability to feel pain, which is nociception. All right, the structure of the nerve connections at your spine. Remember how things are set up from our studying of a nerve plexus and the way that the nerves come out through the intervertebral foramen? There's some overlap between these dermatomes and their neighbors. So, just as a warning, as we talk about these dermatomes going forward, know that sensations that you feel from a specific dermatome can travel through a few spinal nerves simultaneously. All right, everyone, where are the dermatomes? Where do they start? Where do they begin? They are coming from your spinal nerves, which come from your spinal cord, which are protected by your spine. So let's do a quick refresher on your spine. Your spine is a series of interlocking bones called vertebrae. It has 5 sections, all right? The first main one that we're going to talk about is the cervical spine. This is located in your neck. It has 7 vertebrae labeled C1 through C7, but it does have 8 spinal nerves. So if you are reading literature or looking at a picture of a dermatome map, you may see it labeled as C1 through C8. That does not mean that some people have a mysterious extra C8 vertebrae. It means that there is an 8th pair of spinal nerves, although it is interesting, some people do not have a functional C1 spinal nerve pair or matching dermatome, but we'll talk about that in just a minute. Now, C1, if you will recall, is called Atlas. Atlas holds up the world, which is your brain, which is your head. All right. And axis is C2, the vertebrae upon which it pivots and turns. So C1 is Atlas, C2 is axis. They are labeled C1 through C7. Your thoracic spine is next. That makes up your upper and middle back. There are 12 vertebrae here. They are labeled T1 through T12, and these are paired with exactly 12 pairs of spinal nerves as well. The lumbar spine, this is in your lower back. It has 5 vertebrae labeled L1 through L5, and these also have a matching 5 pairs of vertebrae. You also have the sacral spine. This part of your spine joins your backbone to your pelvis, and it has 5 vertebrae, which by the time you're an adult should have fused together, and there are 5 pairs of spinal nerves located here in the sacrum. The coccygeal spine make up your tailbone or your coccyx, and that is 4 fused vertebrae, but it only has one little lonely pair of spinal nerves. One thing I would also like to mention here is the curvature of the spine. So in the cervical spine, you will notate that the convex curvature is facing the anterior portion of the body, as well as the lumbar spine. The convex portion of the curvature is facing the anterior of the body. That means the bodies of these vertebrae are bulging out towards the front of the body. This is a lordotic arch. It is much more pronounced in the lower back than it is in the cervical spine, but nonetheless, they are both lordotic arches or lordotic curvatures. Your thoracic spine, as well as your sacrum and coccygeal spine, are all showing the convex portion going towards the posterior of the body and the concave portion of this curvature facing the anterior of the body. So that concave going to the anterior, making the spine bow towards the posterior of the body, means that this is a kyphotic curvature or a kyphotic arch. All right, we'll call it lordosis and kyphosis when describing this curvature. Of course, excessive curvature we've learned about is hyperkyphosis or hyperlordosis, and hypo means that there is less curvature in those areas. All right, so let's take a closer look at what's happening here, where these spinal nerves come from in the vertebrae itself. So on the posterior of our vertebrae, we have our spinous process or spinous processes, if we've got several. And this is that pokey bit that you could palpate on your client's spine in the back, right? Coming off of each of those laterally is going to be the transverse process. Those are the parts of the spine that stick out to the side. And then in the very anterior, we've got these vertebral bodies. All right. And in between each one, we've got an intervertebral disc that does the cushioning. Now remember, inter means between. Vertebral is referring to the vertebrae. So intervertebral means between. Now, between the body, this big wide body that's in the anterior of the vertebrae, and the spinous process in the posterior of the vertebrae, we have the spinal canal. This canal protects the spinal cord, and it also allows your spinal nerves to branch outwards to the left and right. Okay, they go laterally from your spinal cord to exit the spine through the vertebral openings called the neural foramen, or more often, the intervertebral foramen. Okay, that is where these pairs of spinal nerves are coming out. Your spinal cord is coming up through the middle hole, your spinal canal in between your vertebrae, and then these spinal nerve pairs are branching out through those intervertebral foramen. All right, so let's dive into the dermatomes of the face real quick. Each of these are innervated by one of the three branches of the trigeminal nerve, which is cranial nerve number 5, and not actually spinal nerves. So we have the ophthalmic branch of the trigeminal nerve, which is cranial nerve 5, number 1, and that innervates the forehead and the nose, okay? And the maxillary branch of the trigeminal nerve, what does that do? How about the maxilla, which is the upper jaw? So maxillary branch does the maxilla and the skin over the cheekbones. All right. The mandibular branch, there's your clue. That does the area over the mandible, the skin over the lower jaw, which is the mandible, including the area of skin in front of the ear. The other dermatomes of the head and neck are all innervated by the C2 through C4 spinal nerves. All right, let's dive into the cervical dermatomes, all right, from the cervical spinal nerves. So it's common for people not to have a C1 spinal nerve, which also means they don't have a C1 dermatome, all right? For people who do, that dermatome is at the center of the back of their head, all right? Sort of where someone would wear a high bun in their hair, which would also cover a small area of the posterior neck by the external occipital protuberance, right? When you put your hand right at the back of your head, that's that big bump at the bottom of your skull before it dips into the softer portion of your upper neck. Your C2 is posterior superior, all right, aspect of the head. What does that sound like? the back, and the top, or upper neck, a small area of your jaw underneath each ear, and the back of your head. The C3 spinal nerve area goes to the anterior neck, posterior aspect of the upper neck and head, and supraclavicular fossa. All right, we're back into terminology. Supra means above, and clavicular, I'm sure we're talking about the clavicle, so that's going to be the fossa above the clavicle. C4 is the shoulder and skin of the infraclavicular fossa. Infra meaning inferior or below, so below the clavicle fossa, fossa meaning an indention, and posterior, all right, the back of your lower neck. It does your lower neck, upper chest, upper back, and shoulders and upper arms. Hi everyone, before we get started going deeper into the cervical spinal nerves here, I just want to make a quick note and state that the text descriptions of the locations of these dermatomes and where they map to specific spinal nerves have been taken from 4 different sources. The reason I have done this is to make sure that we have a generalized overview of what aligns with these spinal nerves. Everybody's body is different, which means that when experts do dermatome mapping, depending on the sample of bodies that they use, these dermatomes map differently. So if I am utilizing something like this image that I have here in the PowerPoint from Cleveland Clinic, which I really love, it's one of the best images I've been able to source. We have very distinct lines, especially with the thoracic vertebrae. However, some dermatome mapping looks a little bit different. So if you get asked a question on the MBLEX and it doesn't necessarily align to this, they may not be using the same 4 experts that I have pulled from. They may be using a 5th, 6th, or 7th, or 8th source. It depends on the clinic or neurologist that the mapping has done and the bodies that that particular clinician or expert has done their dermatome mapping with. So keep that in mind with both these and myotomes when we talk about myotomes. Although myotomes match up a little bit better, these are dependent on your client's body, and the answers to the test sometimes directly relate to the expert that you are studying at the time. All right, C5. That spreads over the lateral aspect of the arm. When we're in anatomical position, where is the lateral aspect? That is the radial aspect, right? That is our radius, that is our thumb side. So going down to C6, same side of the body, radial side of the forearm and thumb. So that's our lateral side. It's the thumb side of the upper arm and forearm and your thumb itself. C7, that is the central aspect of the posterior forearm and middle finger. So that is running down the middle of your arm, all right, over your elbow, down your fingers. C8 is the ulnar side of the forearm and hand and little finger. The pinky side, all right, in the anatomical position, that's also the medial side of your forearm and wrist, as well as your ring and pinky fingers. T1, spinal nerve T1 extends to the medial aspect of the forearm and distal arm. T2 is the medial and proximal aspect of the arm, continuing into the axilla. What's the axilla? That's our armpit. So pinky side of your upper forearm and upper arm, and the chest and back area just above your armpit. So it wraps in a ring around your upper chest, just above your armpits. T2 to T3 is the pinky side of your upper arm, as well as your upper chest and upper back, just above the level of your armpits and shoulder blades. So this is where we're stopping on this slide. All right, now we covered the top a little bit. Now we're going to talk about some of the dermatomes of the lower thoracic spine. So the dermatomes of your thoracic spine are mostly on the trunk of your body. That includes your chest, belly, and back. We just talked about the 2 that are in the upper bands of your back right above your armpit, right, and ending right at the armpit level. All right, T1 and T2 are a little bit different than the rest of them because T1 is generally thought to bleed into your arms, and T2 is both on your arms and that trunk circling around that upper body there around the upper armpit. All right, anterior on the body, each of these thoracic spinal nerves is evenly spaced in terms of its dermatome, like slices of your body, like sliced bread, all right? With T2 and T9 being nearly horizontal lines slicing across your body. T10 and T12 have the lower borders that dip inferior on the lateral sides down towards the hips. On the posterior of the body, each dermatome is evenly spaced. Again, sort of like a sort of slice of bread, but now they angle down in the back, kind of like a V shape with the point coming up. The front is like a horizontal band. The back is bent down just a little bit with an inferior lateral sloped lines from the spine. Inferolateral. What does that mean? It means we are going inferior, so downward, and lateral. So we're going at a downwards diagonal angle from the spine, sloping down to the outside of the body. All right, so T3, that's where we left off. The anterior and posterior sides of this dermatome are at the lower level of the axilla or chest and back just as the same level as your armpit and the center of your shoulder blades. So we're going to be cutting right through those rhomboid muscles, but over them because we're talking about what? Dermatomes, skin. All right. T4 anterior is at the level of the nipple or the lower edge of your pectoral muscles. So it's in a band across your back and your front, sort of like you're wearing a teeny tiny tube top that just covers up the nipples and the lowest parts of your shoulder blade. So it's a pretty low hanging tube top that runs across your body for T4. P5, this one in the anterior of the portion of the body is at the level just inferior to the nipple. So we're underneath the breast tissue here a bit, the bottom part of the breast, or across those ribs and chest muscles just below the nipple. T6 on the anterior side, again, we're just dipping down a little bit like a slice of bread. This time we're dropping down to the level of the xiphoid process. Remember, that's the bottom section of your sternum. T7 is at the same level as the lower edges of the lowermost part of your rib cage. So now we're dipping down over that diaphragm, over the edges of those floating ribs. T8 and T9 innervate the upper belly area, including the top parts of your abdominal muscles. But again, we're not doing the muscles. We're talking about dermatomes here. We're talking about skin innervation. T10 is anterior at the level of the umbilicus or the area just above and level with your belly button, otherwise known as your navel. All right, that's wrapping right in the middle and also in the upper middle section of your back, because remember, while it's draped low on the sides, it comes up and tugs tight to the spine in that V pattern to match up where that spinal nerve is coming from, which would be the T10 vertebrae. It's sort of like it's an ice cream cone that's dripping off down into the sides, with the top of the ice cream cone being at the vertebrae and everything is just dripping off and down. T11, the area is level with and just below your belly button and the center section of your middle back. And T12 in the anterior is just superior to the pelvic girdle, all right, or the lowest part of your abdomen, just above the level of your hip bones, all right? So that is your pelvis. So it's sort of just above where you would have like a muffin top over tight lower set pants, or maybe hanging just over a tight belt, right? Just the very bottom of the belly, right above your pelvic girdle in your pelvis and the lowest section of your middle back. This is right before our lumbar back starts. It's the very bottom of the low back, and in the front, it hangs even lower because remember, we're starting high at T12, we're dripping down in that V in the back and looping around towards the front. All right, moving on to the dermatomes of the lumbar spine. These connect to areas on your hips, legs, and feet. L1 on the back. The posterior includes the skin lateral to the L1 vertebrae and wraps anteriorly to the groin and pelvic girdle area, overlaying the inguinal canal so that the upper part of your hips, your pubic area, the upper part of the small of your back, and all of your sex organs are included in here, including the penis, testicles, and vagina. L2 in the anterior covers the thigh inferior to the inguinal canal. So that is everything below that pelvic area that's going to be wrapping in and around. This includes the muscles of the upper thigh and groin and the middle of the small of your back. L3 includes the front and outer sides of your thigh muscles. So this would include your quadriceps area, your kneecaps, and the outer edge of your leg as well, just above your knee and the middle lower section of the small of your back. L4 in the anterior curves from the lateral aspect of the thigh to the medial aspect of the leg and foot. This includes the knee, kind of the bottom portion of it, the surface of the big toe on the medial side, and the medial malleolus. All right, it wraps lateral to medial, covering most of your leg. If it were a little bit higher, it would sort of mimic the sartorius muscle if the sartorius ended up attaching at your medial malleolus instead of your pes anserine tendon attachment. All right, L5 has a lot going on. It is posterolateral aspect of the thigh, wrapping anteriorly. So it goes around to the front and it goes down. It includes the dorsal and plantar aspects of the foot. So it is encapsulating the foot, top and bottom here, the medial surface of the big toe, as well as toes 2, 3, and 4. So the kneecap, the front of your whole lower leg, the inner sides of your calf muscles, and the inner front surface of your feet, including your big toe and second and third, fourth toes. All right, dermatomes of the sacral and coccygeal spine. So the dermatomes of your sacral spine only really include areas around your buttocks and the back of your legs, although it does cover your heel and a little bit of the dorsal aspect of your foot. There's only one spinal nerve in the coccygeal section of your spine and only one connected dermatome as a result because there's only one little spinal nerve pair there. So let's talk about S1. There are a couple here, but S1 extends into the posterior lateral aspect of the thigh, the popliteal region or popliteal, tomato, and leg into the lateral malleolus. So we're going to the lateral portion here, the lateral margin of the foot, heel, and little toe or uppermost section of your buttocks, including the gluteal cleft, which is the uppermost area where your buttocks separate, the middle and outer sections of the back of your thighs and calf muscles, the outer side of your ankles, and your fourth and fifth toes. The S2 spinal nerve extends from the buttocks to the posterior medial aspect of the thigh, popliteal region, and leg. In the anterior portion, it includes the penis and the scrotum. All right, S3 in the posterior portion of the body includes the medial aspect of the buttocks, the perineal area, and in the anterior, it includes the penis, the scrotum again, or it is sometimes listed as a vertical area at the middle of your buttocks, extending downwards through the inner middle section of the back of your thigh and the upper middle section of your calf muscles. The S4 is the perineal area and the genitals. The S5 is perineal area again, and the skin of and adjacent to the anus known as the perineum. And also your little coccygeal pair there, CO, that is innerving the area directly around the anus itself. All right, so some conditions and disorders that are going to be affecting dermatomes. An injury to one or more spinal nerve roots obviously can affect a dermatome. If we affect the nerve, we affect the dermatome. Common causes would be like trauma, like car crashes, or like a puncture or a vertebral fracture that impinges that nerve in some type of way. There's congenital conditions like spinal bifida, spine tumors, cancers, cysts, fluid-filled cavities, anything that's going to cause inflammation or swelling and push in on there. Of course, infections that can cause inflammation can also squeeze down on those. Lack of blood flow. Remember that word ischemia. All right. Lack of blood flow can also cause an issue because your nerves and spinal cord need blood flow like all other body tissues to feed oxygen and nutrients to the areas to pass through to them. Loss of blood flow can happen because of a blocked blood vessel or blood vessel rupture, of course, impingement as well. Any disruption in the signals from your spinal nerves can cause sensory symptoms, okay? That we are getting our sensations in our skin from these. Where is that coming from? Well, you could get tingling, which is paresthesia. You could also get numbness, which is hypoesthesia. You could get pain, all right? You might want to look these up like allodynia, hyperalgesia, or dysesthesia. These are all important terminology to break down, right? Dys is dysfunction. Hyper, all right, is going to be excessive algesia, excessive pain. Allodynia, this is a supersensitivity to light touch that would not normally be identified as painful. So please be aware of this. You might have dysfunctional sensations, dysfunctional ability to feel pain or sensations of touch. You may even have some damage that disrupts autonomic functions to a dermatome, all right? Like sweating too much, that is hyperhidrosis, or not sweating enough, that is anhidrosis, all right? Remember that AN means lack of or without, hydrosis being the condition of sweating, all right? Hyperhidrosis, excessive sweating, and hydrosis, not sweating enough, believe it or not, can come from your dermatome. All right, that's all I have for today, and we'll be talking about myotomes a little bit later.